Do you mind that we film you?
No.
Okay.
Okay, so this is a fairly good model. So what do we have? We have the thyroid here, thyroid gland, and the larynx. And then of course we have the two lungs, here and here. And of course we have the heart. This is the superior vena cava. This is the ascending aorta, which you can see on this model. This is the trachea coming down, dividing into the primary bronchus, going into the lung. This tube here is the esophagus, okay, which runs down through the diaphragm and into the abdomen. Here is the liver, okay, again, smaller left lobe, larger right lobe. This is the porta hepatis. The red is the common hepatic artery. This is the portal vein, and this is the common bile duct. And of course, this is the gallbladder. It just kind of sticks out a little bit on the leading edge. And in life, all the tissue around the gallbladder, like the inside of the wall of the abdomen, it'll all be stained green. This is the inferior vena cava. Remember I said it really goes up and the liver kind of closes around it, so you really have to kind of rip it out of here. So that's the inferior vena cava, and the hepatic veins come out of the liver and go directly into there. This is the stomach. Again, this would be the fundus. This area that's showing now is the body of the stomach, and this is the pyloric region. Here they're showing you the rugae of the inside of the stomach, and as the stomach would fill up in a large meal, eventually that'll be perfectly smooth. Okay. Here is the pancreas, as we saw in a number of our cats tonight. This is our spleen. It's like a half a softball stuck up there into the upper left quadrant. Okay, so I'm going to take this away for a second. This is going to be the duodenum, leading to the jejunum and the ileum. Don't worry about identifying the jejunum and the ileum. It's kind of crazy to kind of figure out where one starts and where one stops. So we take that off and try to put this back in. Okay, so this is going to be the large intestine. This is where the ileum goes in to the colon, and then from that below is going to be the first part of the large intestines, where this is the cecum. This is the ascending colon. This is the transverse colon. This is the descending colon. And then again, we're stuck on the anterior ileum, and we've got to make a crazy S turn to go midline and posterior. So this is the sigmoid colon. And I'm not sure, it doesn't quite show the rectum. Okay. Here is the uterus, and the ovaries in here, and the fallopian tube. And underneath the uterus is going to be the urinary bladder. So the uterus sits on the urinary bladder, and during pregnancy, women will complain that their bladder is always feeling full, and that's because the uterus is obviously large and is pressing down on the urinary bladder. The two kidneys sitting on the superior lobes of the kidney are the two adrenal glands. And that's really all you can see. This is the abdominal aorta. It divides into what is called the common iliac artery. The common iliac artery then divides into the internal iliac, which dives into the bowl of the pelvis, and this is the external iliac that then goes through the inguinal canal and onto the leg as the femoral artery. And that's it. Okay?